Welcome to Detox Living, where we bring you truths, tips, and testimonials to power your toxic-free living. I'm your host, Coach Gessie. I am a fibroid survivor turned health activist and founder of thedetoxnow.com, a holistic health provider of education and supplements to combat the nutrition and health disparities that lead to obesity, chronic disease, reproductive health issues such as fibroids and more, as well as lower life expectancy rates. Here tonight, our topic is secrets that my GYN never told me. And I am extremely happy and excited to have a conversation with none other than himself, the Fibroid Slayer, Dr. P. He's actually a minimally invasive GYN surgeon, Dr. Pierre Johnson, who is known as the Fibroid Slayer. So I'm going to bring him on and we're going to dive into this topic. Hey.
Hey, how are you?
Good. Dr. P himself. It happened for real. We're on live for real.
We're on live for real. We're here.
Don't, thank you for being patient with me. I know the schedule is kind of iffy. But you know, that title is something else, you know, the Fibroid Slayer. And I thought before we get into your story, you know, we haven't talked, so I wanted to kind of tell you why I even want to talk about this, you know, let you know what my story is and why it started this whole work. You know, just quickly, I'll run it down for you. 2001, like our own little, you know, consultation here. 2001. I was diagnosed with fibroids when I was unable to conceive for about 6 months. Husband and I were ready to expand our family. I was told, right, because this is about what your GYN told you. Mm-hmm. I was told that a bikini cut C-section open myomectomy was my only option for preserving my fertility. It was 2001. It was quite a bit of time ago, but from my understanding, you know, minimally invasive options were available at the time. Am I correct?
2001.
Don't act like that's so long
ago. They were there, but not. People weren't good yet. They had just really started at that point.
Okay, so maybe that was true, because I'm trying to do an evaluation here, right? So people might not have also been as skilled, right? Okay. So they said, you're going to get pregnant right away. Will be no problems. Well, that didn't happen. Fast forward 5 years. Not only was I without a baby, but fibroids were back, 2006. Mm-hmm. And now I was experiencing severe, like pain, sciatic pain, where I couldn't walk, shooting down my legs. That happens when the fibroids is pressing on your sciatic nerve. And literally some people are rendered unable to walk because the pain is so severe. And I was, you know, in that case. The GYN told me, he was a GYN and a fertility specialist. This time I took the level up to a new physician. Mm-hmm. And he said he'd never seen a case this bad in his 30 years of practicing. I was like, oh, that's encouraging. And guess what he told me, doctor? He said a myomectomy was my only option to preserve my fertility, and that it would need to be a vertical incision. And I'm saying this because I know you have a specific perspective on vertical incision, right? Yeah. I boo-hoo cried in that doctor's office when he told me he was going to jack up my tummy. Yeah. Right? Yeah. And had the surgery. It was supposed to be great. Went home. 10 days later, I'm back in the hospital because guess what? I have a small bowel, which is small intestine obstruction from scar tissue, where he had to cut me back open, stem to stern. And they removed 18 inches from my small intestine. Okay. Now that complication happened because scar tissue, when it's really bad, it actually can wrap around different organs. It caused a knot. I literally could not keep water down. I couldn't keep my own saliva down. All right. And they cut me back open in order to remove the knotted up, which was, it formed adhesion, scar tissue. Your body has to form scar tissue to heal. But it was so radical and overgrown that it was wrapped around my organ, my small intestine. So 2000, that was 6. They said, oh, guess what? You can't do anything, but you have so much scarring around your fallopian tubes. You're going to have to do IVF. It's your only option to conceive. because of all the scarring, right? That precipitated 5 IVF procedures. The first one, I had a miscarriage. Then didn't have, you know, a no take, but then fibroids came back. And I had to have another myomectomy in between there. Another one vertical, and more of my small intestine had to be removed. 20 plus days in the hospital, grueling recoveries each of these times. And then I did conceive the 5th IVF cycle. I'll spare you all the complications with the baby because fibroids came back during the pregnancy. And she had a condition called fetal growth restriction, which the fibroids were taking the life away from the baby. I did, you know, carry her to 32 weeks. My heart stopped on the operating table because of all the scar tissue they had to manipulate through. But she was born, a miracle, praise God. Her name is Nia, and she's an amazing miracle. And I wish I could tell you that was the end of my fibroid journey, but it wasn't. A year later, I had UFE because I was like, this is it. I'm going to do UFE. People said it's the silver bullet. Lies. They said the silver bullet. After this, you'll have no more problems. You cut off for UFE is, for people to know, they put these particles in to block off the arteries, the uterine arteries, which says that they will now cut off the blood supply to the fibroids, which means they'll die off, which they did not, because a year later, 2014, actually, one of the most stressful years of my life, fibroids came back aggressively. And the doctor said, this time you need to just do a hysterectomy and another small bowel resection. Exactly. So now, 2019, okay, hysterectomy's done. I'm thinking this is it. This is my 3rd small bowel resection. 4th at this point because they had to do a repair with the baby. 2019, they're like, oh my God, I'm anemic. I'm losing blood all the time and we don't know why. I don't have a period because I've had a hysterectomy, right? Well, I'm bleeding at the anastomosis. The anastomosis is where they cut this. Of course, you know where it is, but it's where they put the small intestine back together because they have to cut out the bad part and they put it back together. And it's basically the seam of where it's sewn back together, right? Here it's bleeding like all the time. So I'm constantly anemic, which has become ulcerated, right? And so they had to cut out more of my small intestine to where I was left with less than 100 centimeters, which is less than 3 feet of small intestine, okay? And you can imagine that now I have a chronic condition that I have to manage around, a chronic gut condition, because it takes, you know, what your body normally does in 20 to 25 feet of small intestine. I have less than 3, right? So what this really did for me is, it's made me say, okay, traditional medicine has failed me in the sense of this couldn't have been only what was available to me. And it made me start looking into, you know, what else is available in terms of what I can do. Because I know nothing about no herbs. I believe in nothing natural. I had all those surgeries. You got to know that, you know what I'm saying? So for me, that's what brought me to where I was like, okay, there has to be more. And then helping women say, not instead of, but what can you do in addition to what is available to you traditionally, right? What I call integratively, right? Yes. So I want to put a pin there before we go back to that concept, because I want to switch now, pass the mic to you to say, now tell me your story and how you became known as the Fibroid Slayer.
So real quick, I don't want to bore everybody, but you know, I as a kid, you know, I decided I wanted to do just OBGYN because I was just fascinated with childbirth. I had a really troubled beginning. You know, my parents were addicted to drugs. You know, I was just challenged to, you know, come up with a plan B other than play professional sports. And like the only thing positive at the time was the Cosby Show. So it just, you know, that's where it started. And then, you know, I just— Is
that because of Heathcliff, because he was an OBGYN?
I started.
Wow, that's pretty amazing. That's something about representation matters. That's a huge story around representation matters.
That's why I push for it so much now. I mean, if you don't see, you know, you don't see better, you can't do better. You know,
that's right. That's right. That's powerful, brother. That's powerful.
That's what I saw. And then, my mom was pregnant with my first brother when I was 9 years old. And I was just totally fascinated with childbirth at that point. So, I knew that's what I wanted to do. But then as I got older, I'd start cutting hair when I was in high school, and I was really, really good at it. And then
So with the blades, huh?
The blades. So I learned like I was really, really good with my hands, like dexterity wise. Cut in the barbershop before medical school. And so as I really learned about, just the gynecologic aspect of the profession, I really, really, really honed in when I went to start going to medical school. I was like, I'm already a barber. I know how to use a blade. So I really want to focus on being the best surgeon possible. And it's just a lot of things that happen from medical school through residency. I did a year general surgery. I just had, just a very difficult, but a very beneficial course for learning surgery, in addition to already having just being very good with, scalpels and blades.
What made it difficult for you, if you don't mind me asking? You said it was very difficult.
Well, first of all, I was the only black kid in my medical school class. So
Tell it. Wow.
Wasn't prepared. I wasn't prepared for that. That was a big culture shock coming from the HBCU. And then
wait, where'd you go?
Xavier of Louisiana.
Right.
And then so from there, residency, I didn't get into OBGYN in the beginning, and then I basically did a year general surgery, which was like the gift. It felt like the worst thing in the world at the time, but it was the best thing that ever happened.
Really?
Yeah, because it really, really showed me the art and the craft of surgery. So when I did go into my OBGYN residency, I was fortunate enough to land in a place where there was nothing but opportunity. It was a small town in Illinois, but it was robust with patients and a lot of good surgeons. So I went in there with really, really aggressive, trying to learn everything. I stayed up 2, 3 o'clock, 4 o'clock in the morning, learning the robot, when as soon as I was able to do it, my second year. So I really, really became proficient. That was my whole motive, just to be the best. Dude, just really, like people play basketball and shoot jump shots. That's how I did surgery. So when I was done, I was like,
you want to be the Jordan,
correct.
Huh?
I was like, when I was done, I'm like, I'm really good. So it's, so when I usually when people finish residency, they're really kind of timid, and then they go somewhere where, they're sheltered. Well, I went to a place, even smaller town, Illinois, where it was just, I was on an island. It was like, I was all by myself, autonomous. So It was good surgery, just cranking out surgeries. And then I just got really proficient at my craft, and I just the things that I learned.
You said surgery, so these were fibroid surgeries?
Yeah,
because you were now in GYN.
Robotic surgeries, a lot of robotic surgeries, a lot of GYN, a lot of fibroid surgeries, a lot. And I was just using. I'm one for common sense, right? So things that you learn in medicine, a lot of times it's people just textbook things. I'm a common sense person. I utilized all of the things that I learned, and then I started using my common sense, which then
hopefully everybody should be doing that.
Right. So in residency, it was I did see vertical incisions and all that, and when I got out, I was like, I'm never doing that. There's no need to ever do a vertical incision. I was like, if you could deliver 8, 9, 10-pound baby from a horizontal bikini cut incision, why can't you do that for the same fibroids? It should never can't do that. So I worked on that craft, and then same way with the robot. I said hysterectomies, you should never have to open anybody. As long as you have this robot here, you should be able to laparoscopically do hysterectomies. And so it was cases that everybody just wouldn't do. I was like, I'm gonna do it. I struggled in the beginning, but then it came time to doing 6 pounds, 7 pounds, 8 pounds, 9 pounds. I'm doing it. And people was like, oh my God, kind of freaked out by it. But I'm just it started to become routine for me.
Change it. So you started to really, it's with what they say, you break the sound barrier, right? So it's you started to create the norm of, no, this is not necessary.
Correct.
Right? It can be done a different way.
Yeah.
right? So is that how the moniker Fibroid Slayer came? Like, how did that, is that something a patient gave you? You just
Yeah.
decided, you know what, this is going to be my, you know, ambition, you know, the thing that calls me forth. Like, how did you land that?
Because I was kind of late on the Game of Thrones bandwagon,
Ah,
and but I really
I ain't gonna lie.
yeah.
Me too.
And then I had like a ringtone. I had like the Game of Thrones like thing on as my ringtone like way back, and like one of the patients heard, and it was like, you slay fibroids. Like we was talking about one of the characters. It was like, yeah, you like kind of like a fibroid slayer. Like I was like, I am. And then as I started looking, I was like, you know what? I was like, I have all these cases that like when women say I got vertical incisions, I had to have a hysterectomy. Nobody, I went to 5, 10 doctors. They said they could not save my uterus. They could not do this. They could not. Like I do this routinely.
Yeah.
So I'm just like, I see that I'm in a lane where there are not many people in and won't do the things that I do. So I'm like, I'm that guy. So
I love that. Before we go further, you know, I want to kind of address the elephant in the room.
Sure.
Right? The elephant in the room is you are Mr. Surgery. Like, just like you just said, you just built it up. You are Mr. Surgery.
Mm-hmm.
And there is this idea, you know, trained in traditional medicine, and honed your skills specifically around minimally invasive, which is very elite level of surgery, right? Not elite as in it should only be available to the elite and exclusive, but in terms of the level of precision that's required, right?
Yep.
And the work that we do is really, it's, you know, holistic, not in there's this definition of holistic that people have, which means that, you know, I'm going to be over here with the burdock root, okay, and I'm going to look at the eye. I saw a video, you said, look, this is endometriosis.
Yeah.
That's, please, okay? And, you know, listen, I'm not knocking anybody, but I'm saying like real medicine for me, holistic means integrative, okay? Holistic means look at everything that's going on, right? And look at everything that contributes, everything that you have that plays a part, and options, and take advantage of all of that, right? And I say this is really important because, again, the credentials for traditional medicine, many times they're seen as against holistic medicine, right? And they're seen as mutually exclusive, like you have to choose either or, right? And I'm very intentional on breaking that myth, that just, to me, it needs to be debunked, right? So people may be saying like, well, why Coach Gessie, why are you talking to Dr. P? I thought you wanted to do everything without surgery. Guess what? I wish I never had one surgery, Dr. P. I wish I never had one surgery, because even if it's minimally invasive, it still has the call. It still has the risk.
How minimally it is, it's still invasive.
It's still, exactly. It's still, the risk of surgery is still there. Hey, Hope, that's my boo. That's my that's my client and your client, right? So the question is, I want to make it clear. So in your perspective, what are your thoughts on that? You know, like, is it you have to choose traditional versus, you know, what are your thoughts? Help me debunk that.
Sure. I don't think you do have to choose. I think that is definitely a misconception. I will say that, you know, there are many doctors that get into that, you know, this is the only way type thing. I'm not that person. I am a realist, and I tell people what I know that works. Build and people that consult with me and talk to me, if you do not need surgery, I have zero interest in operating on you. I will, you know, I will tell people, I just have 3 or 4 patients, you know, this week, and I'm saying, you are not a candidate for surgery. I don't want to operate on you. Surgery is needed when it's needed. And if you don't need it, it shouldn't be used. And the thing that I would say is that we should be preaching like healthy diet, healthy lifestyle and stuff all
day.
it's the problem is that we get and we have these issues that come up, and now we want to.
Yep, crisis. We're putting out fires all the time.
Correct.
Exactly.
And
you know, that's crazy. That's crazy.
yeah,
It's crazy.
you can't, you know, once the damage is done, you know, once you have had 35 years of eating healthy, unhealthy, and, you know, and not taking care of your body, it's very difficult to say that, hey, in these 6 months, I'm gonna just completely change my diet. And thing is going to change. Whereas we need to start preaching, like, we need to stop eating a lot of these processed foods. We stop, you know, and watch the things that we're putting in our body. As much as I talk about surgery and fibroids and all those things, I'm also talking about health, wellness, working out, those types of well, and that's what I preach to my patients. So healthy diet and healthy living is what we should be doing for our overall health.
Period.
You know, outside of fibroids and hypertension, diabetes, it's a preventative measure.
Exactly.
Right.
Exactly.
Preventative measure of how we utilize, you know, our natural herbs and medicines. But you know, surgery is there for, like, you know, again.
Yeah. You know, I love so many things I want to pull on what you said. So, you know, number one is that what we talked about, prevention is the cure. Prevention is the cure, meaning we don't want to get to that point. We don't want you to get you to the point before you even get to where you are dealing with hydronephrosis, because, you know, I have referred clients to you, right? Because of the fact that you specifically are willing to take cases that people will not, right? And you're also going to be very truthful about situations where, you know, it's like, listen, you know what, that's that right there has to be operated on, right? Versus, like you just said, no, that doesn't, like, you need to look at other means, right? So for me, that's so critical. And, you know, in terms of the case, what you just brought up, you said there were 2 cases. You said no. What? Let's dig into that. What are cases for you that you saw? You were like, no, I'm not. You're not a candidate for surgery. Let's dig into that a little bit.
Well, I mean, the myth is that if you have fibroids, they have to be treated or removed, and that's not true. You know, fibroids are they are benign growths of smooth muscle, and if they're not significantly impacting your quality of life, they're not causing you pain, infertility, you know, frequency of urination, pain with intercourse, if they're not impacting your quality of life, you don't have to do anything about them. And that's even the big ones. You have the option of just watching and doing nothing about it. So that's really what I'm looking at. I'm looking at the size and the location and what the goals are. If you have, you know, fibroids that are really not impacting your quality of life, you're really not worried about having children, or you know, things that they're not impacting you, then no, you don't need surgery. You know, it just really depends on what the goals, what
the goals and what you're experiencing, right? So where you say you don't have to do anything, we say no, use lifestyle changes aggressively so that you don't get to the point where you have to do something, right? So when you say you don't have to do anything surgical, no, because I heard you say, yeah, you should always be doing the healthy living, right? Sure. You should always be doing that. You don't have to necessarily do something surgical at that point, right?
Yeah, absolutely.
Right. And that's a critical piece, because, you know, there are people who they have been told, because there's a fear, well, I have tumors, right? Okay, but what's happening to you, right? So, all right, like there's a case that I referred to you this week. It's like, okay, I know she's trying to get pregnant quickly. You know, her age is a little bit more advanced, and she's trying to move forward with, you know, she wants to be a choice mom, meaning she wants to do IVF, and with a donor, she wants to get pregnant. And she has fibroids in the way. They're causing issues. So I said, okay, you know what? Because of that, I know you wanted to tackle them naturally. However, time, like you said, they didn't happen in 2 weeks. They happened over time. Right. Changing the lifestyle that helps to tackle the root issues, that takes time. And with the timetable that we're looking at in the fertility factor, we need to accelerate the removal of those fibroids so that you can now advance to the next level, right? Another case, which I referred to, was a woman who was dealing with hydronephrosis, which is where the fibroids were actually pressing down on the kidneys, where it could now cause kidney failure. She actually had damage to two of her ureters, right? That is nothing to play with. Kidney damage, you don't play with that. Are you kidding me? Right away, you cannot play with that, right? So I think that it's understanding, but in the past, it used to be, well, your only option is to get a hysterectomy. What I love, I'm like, listen, if there's any option of saving your uterus, Dr. P is going to give it to you. Absolutely. If there's any option of, and you need to be cut, again, if you don't need to be cut, baby girl, like, let's work on the vitamin D deficiency that's probably playing a major role. Let's work on the estrogenic diet, the hormone disruption. Let's work on the products that you're using that are causing hormone disruption, that are now escalating estrogen dominance. Let's tackle the root issues. We've seen it. I mean, we've seen women, one of our clients, we were on Angela Yee, on her show, she eliminated a 10-centimeter fibroid. She wasn't in a situation where it was an emergency and she was dealing with anything life-threatening. In 6 months, she MRI documented, Dr. P, right? Same doctor, MRI, like he said, well, it's not there anymore. I know it happens. We've seen it. This is not just one. But if it's someone who has these specific scenarios and issues, baby girl, I'm going to tell you, we need to look at the things that are going to help you with your goals. And we always say you can heal, but you got to stay alive, right? If these fibroids about to take you out, we need to advance this intervention, right? We need to advance it. It's a critical thing. So in the scenario where, you know, where you're looking at, because many of you, in fact, I have to send you a copy of our book, End Fibroids Manual and Guide, Dr. P. I think you're going to love it. I had a GYN tell me today, she said, you guys have literally covered everything, because I was so mad when I was going through fibroids, Dr. P. I said, we have to write the book that you need. I wish I had, because everybody who's dealing with fibroids, they basically have to become like a research assistant. They have to become a research person, because everything's not in one place. You see what I'm saying? Like, okay, if I ask you, you know, what are the options surgically? It's either they're only talking to you about, you know, open surgeries, or they're only talking to you about birth control, right? Or they're only talking to you about all these other things. And we were like, listen, there has to be a way for you to become educated, because most people, not every GYN is like you, Dr. P. They're not going to say you don't need surgery when you need surgery. And they're not going to tell you that there's another way to have surgery and keep your uterus. You see what I'm saying? So knowing everything that's available is critical. That's why we had to, you know, put it into this book, which leads me to the next question, which was, you know, we talked about prevention, and we know that studies show that up to 33% of fibroids return after a myomectomy, and up to 21% have hysterectomies within 5 to 10 years. I know when I've spoken to you before, you've talked about how, you know, your stats have been different, have been better. Can you unpack some of that, and also talk about what are some of the things you tell your clients to prevent fibroids from returning?
So, you know, when you look at studies, you know, in anything, it's going to talk about every person that does fibroid surgery. So you're going to look at all of those patients. We're not built the same. You know, if I have Joe Schmo surgeon that will go in and remove just the big fibroids and is not very thorough and remove the fibroid tissue, those patients are going to be lumped in with the open myomectomies that are very thorough. So when you look at the data, you can't delineate like who had this, who had that, or whatever. You're just looking at all open myomectomies and looking at the return rates or what have you. I can sit in here in front of you and tell you that my open myomectomies, I have not had really one come back with advanced fibroid disease. I'm not saying that they won't come back, but if you, my philosophy is if you get all of the fibroid tissue, all of it, like really be diligent about getting every fibroid, not leaving one behind, then the chances of them recurring are nil to none. And if they do come back, they'll come back to the point where they won't have enough time to become problematic to where you don't know that they're there. So that's what I say. And as far as you know, prevention and moving forward, it's just really like healthy diet, healthy lifestyle. You know, it's a lot of things that are unknown and that we don't know. We don't how processed foods and a lot of chemicals and things that we have in our environment, how it rolls on not just fibroids, but other cancers. Like
Absolutely.
we have, you know, people that are dying of colon cancer in their 30s and whatever, when that didn't happen, you know, 100 years ago. So, you know, these processed foods and the things that we're putting in our body are causing abnormal changes. So,
absolutely.
reach.
And I don't know if you know about the studies have shown in terms of more than 50% of our tap water is literally is replete with PFAS, you know, with forever chemicals.
Yeah.
You know, that's really important, as well as, again, there was a study that the EWG did that talked about how 78% of the products marketed to Black women actually have harmful ingredients that are either that can lead to cancer-causing agents, hormone disruption, and reproductive damage.
Yeah.
So again, when we look at what are the things that we can do, these are the things that we want to equip women to do with balance their hormones. That's a critical thing, right? That's why for us, our supplements are around hormone balance. Inflammation is a big thing, right? As well, because inflammation causes a lot of issues. And when you look at just the stressors of being Black in America, period, you're always dealing with inflammation because of the cortisol hormone that's always being, you know, pumped into our bodies from the stressors. And vitamin D deficiency with our melanin blocking the absorption of the UVB rays that cause the vitamin D hormone. That's a big deal because the vitamin D hormone studies have shown how it plays a huge role in terms of helping the body to fight and restrict the growth of fibroids, as well as to regulate our stress hormone. So it's like, okay, what are the things that most Black people are not even supplementing when it comes to vitamin D? And we need it because we're not in the sun. When the sun is at its highest, and our melanin, the more beautiful melanin we have, the more we block the sun. So that means 76% of African Americans being 76% of African Americans are actually vitamin D deficient and are not focusing on that. Your doctor tells you you're vitamin D deficient. Okay, when are you gonna start paying attention? When your hair starts falling out? When you're dealing with insomnia? I literally could not sleep for a year when my vitamin D was deficient, and that was not related to fibroids. It was related to something totally else, totally different. It was related to a brain aneurysm. All right. Next, we talk about, you said earlier, which was that there's no need for a vertical incision. I need to understand. I need you to talk about how and you're able to proclaim that so confidently, right? Like in what cases? Because one of the things when that doctor told me, and I felt so silly when I cried in that doctor's office, he said, well, in order to be able to see properly and for it to be safe, don't you want to live? Don't you want to live? Don't you want us to be able to have the proper line of sight to everything that's, and again, this is 2006. Yeah. So maybe he didn't have these tools. So, you know, again, I'm grateful I'm alive these days, but I don't want my clients, I want them to understand they don't necessarily, again, if you have to have surgery, there are options outside, right? If you choose, and I just have to, if you choose to, because you might just choose, but I want you to know, whatever you do, always do the lifestyle changes, always on top of surgery, if you're going to do surgery. But talk to me about the vertical incision.
You know, so it's just there's just no reason for a vertical incision for hysterectomies or, you know, myomectomies, unless a woman has had a vertical incision in the past and she wants to utilize that scar. Vertical incisions.
Why would she want to use that scar? Because it opens it up to more scar formation.
I mean, then they have to live with T incision. So you got to have.
Oh, I have a T. But what if she already had both? Like me?
But it's patient choice.
Okay.
Like, so I've had a patient that, you know, they don't want another incision. They would rather you utilize that incision and not create a new incision on their body. So that's a woman's choice. But you know, it's just you don't have to do that. You know, vertical incisions increase risk of infection, increase risk of bleeding.
Yep.
Increase the recovery time. And a lot
clotting. Anytime you're dealing with more.
The thing that we don't talk about the most is the psychology of women. You know, it's like, you know, I'm always concerned about the cosmesis of incisions or what have you. You have to live with that for the rest of your life.
I'm telling you, I literally I bawled in that doctor's office. I was like,
you don't you don't want to have to be, you know, that just psychologically puts, you know, just a weight on women, you know. So, you know, doing it and to be able to avoid a lot of these risks is something that a lot of doctors don't want to do because it inconveniences them.
Yeah.
So, and
that's it right there.
my whole
inconvenience.
I will inconvenience myself so the patient is not inconvenienced later. And so with that thought process, you got to have the mentality, and you have to be able to do the cases that people don't, that can be done horizontally. Like, for instance, like I had a woman fly in, you know, from New York. And it's on my page. She's cool with it. 13 and a half pounds of fibroid, with a long fibroid being over 7 pounds. They all in there, vertical incision like this. Horizontal incision down in her pelvis, literally like this. You know, so if I can do that, there's absolutely nothing that can come, you know, through my office that I can't do through a horizontal incision.
No,
it's just doing.
That's phenomenal.
Confidence. You know,
but you just said another thing that was really important, and you know, the things that I say to people, if your GYN is not, you know, okay, because I know, do you actually practice GYN medical care or just surgery? Because some GYNs do.
I mean, I still.
Okay,
so
you still do clinic. Okay, that's what I was asking. Yeah, but some people, they're like, I just do surgery, you know.
No. I mean, it's just my niche, and that's what people are attracted to me or coming to me for, because that's, you know,
yeah, but you do the care as well. But so I said to people, if your GYN is not talking to you about, you know, vitamin D deficiency, estrogen dominance, you know, what else did I say? I said hormone disruptors, like the things that you need to be aware of. I said that also means they're not going to refer you to somebody else. Like, they're not going to be someone who is trying to equip you with information. You need to run to find somebody else. The other thing is that they will not, if they don't, I always say, if all they got a hammer, they're going to tell you everything's a nail. Okay. Because they're not going to tell you, oh, you know what, you should go to this surgeon instead. Absolutely. Because they're skilled in that. And that's really important to understand. This is why who your tribe is so critical. It's important for you to be equipped. When I say to my clients all the time, remember, when you go see a physician, there are 2 experts in the room. You are the expert on yourself. Correct. And the physician is the expert in their field. If they are not, if they're dismissing your voice, if they're telling you that what you know about yourself, then you need to find someone else who's going to respect and listen to your voice, as well as understand that it's a partnership. There's no pedagogy where it's like, I'm just telling you what to do. You just said it's the client's decision, right? It's their preference, right? Absolutely. And that they have the confidence to say, you know what, this is not my specialty, but this is someone else's specialty, and I'm going to refer you to that person. That's huge. How much is talk to me about that? Am I saying something that's true here? People driven, like, you know, it's people that just don't have a lot of humility, that you know, that have big egos, and they don't really think about, like, the patient. They're more so egocentric when it comes down to it. You know, I've had doctors that know that of what I do, and know that they have patients that they couldn't manage, and, you know, they still try to either do it anyway, or maybe give it to somebody else that they know or in their practice that can't do it either. Just out of spite for me. I'm just like, you're not spiting me. You're really doing a disservice. Hurting the patient. The patient at the end of the day. Because if I can't do something, I'm gonna be the first to tell you I can't do it. Right. You know, I have limitations. And patient, somebody who knows what they're doing, but I see it all the time. Like, all the time. Let me ask you something. I saw your expression when I said the UFE, and I want to tackle that real quick, because there are doctors out here who are selling snake oil, saying that the UFE is a silver bullet, and I want you to hear us, that it's a silver bullet, and if you have it, you never have to worry about fibroids again. Please. I'm gonna say it right now. That is a lie. I had the UFE. I was in an interview with this physician, right? I was the guest. I was the on-air expert, and he was talking about, all my patients, I had a UFE. They give them the UFE and never suffer again. I said, well, hold on. My fibroids came back. Huh?
People that do UFEs, the interventional radiologists that do UFEs, don't take care of the patients. So they don't see it.
Right.
So an interventional radiologist is the person. They do not take
They don't care. They don't care for they don't have the patient care. That patient is not going back to them on a regular follow-up.
Exactly. So for me, and at first I used to kind of pins and needle it, but I'm very, very direct and blatant about how I feel about it now. One, I feel it's a trash procedure. Two, I feel that it is a procedure that is pushed by gynecologists that are not good with fibroids, that can't manage fibroids appropriately. So they have this option of the minimally invasive approach to just put you through it. But the truth is that they're not
because
confident
they say non-surgical. You go home with a Band-Aid. Non-surgical.
So if I tell you, I wouldn't have my mama, my aunts, anybody I know do that procedure.
Tell why. Tell why. Let's tell why. Unpack why. Why is it a trash procedure? Let's get into it because I got stuff to say too.
Absolutely. So it's like, so if you prime example, if you sit on the toilet too long, right? Your legs are going to start to tingle. Your feet are going to start to tingle, get numb. If you sit on your hands, they start to get tingled. When you cut off anything, it causes hypoxia. If you sit down on anything for too long, you cut off the blood supply, it'll cause hypoxia. Same thing that happens when you do a UFE. You are cutting off the blood supply to living tissue, even though you don't want it, it's still living tissue. When you cause hypoxia to tissue, it is painful. Right? It's called something's called ischemic necrosis. If you look at my page, I talked about UFEs and what I feel about it. And I actually had a picture in the middle. I couldn't leave it up there long because they'll block it. But it showed an actual fibroid or actual uterus of somebody that I operated on that had a UFE and what it looks like. Caseous necrosis, right? It's dead tissue. It's necrotic. It's necrotic dead tissue that you will have to live with in your body. Right. And that is painful. So if you give me 100 women, 90 plus of them that have UFEs are going to hate it and not feel okay. And it'll be 5 or 10 of them that say, oh, it's great, or what have you. Why those 5 or 10 feel that way, I have no idea. But the overwhelming majority of women that get UFEs are in pain and are not happy with it, which is why I don't recommend it. And if you think about it, it just is not dealing with the problem, right? It just is not. It's just cutting off the blood supply, but it's still going to be there. Now you're trading one problem and creating another problem, which is never good.
And there are risks of those particles going to other areas of the body, right? Absolutely. In my scenario, it just didn't work. Like the fibroids came back aggressively and I had like very aggressively, whereas hemorrhaging and all this other stuff, right? So that, and guess what? After that, when I had a partial hysterectomy because they left the ovaries and the cervix, right? I went into full-blown menopause. And they were like, we don't know why. We don't know why. I was like, well, something was different down there, wasn't it? Like out of nowhere, you leave the, somebody said it didn't work for me either. You left the, the ovaries, and all of a sudden at 44 years old, full-blown menopause. Right. And really, they wanted to put me on the estrogen patch. That's when I said, I'm not going to go from fighting fibroids to fighting cancer. We're going to find we're going to find something new. And that's literally what birthed the Detox Now. It birthed the work that we do. It birthed the supplements that we created, and my partner, and that's how now, I don't have any menopause issues. I am 52 in less than a month. And I have no symptoms whatsoever. I take our balance hormone every day. Our balance supplement for hormonal balance every day, as well as, the vitamin D deficiency and different things like that. And the body knows how to heal itself with the right support system, the right diet. If I need medical intervention, of course, I see all my doctors, probably more because of everything I have going on in my life. So, you know what I'm saying? So I know we're taking a long time. I want to do two more questions. What is 2 to 3, and I think we might go a little sticky here. 2/3 of hysterectomies are performed in the southern states.
Correct. Okay.
Fact. What do you think drives that, given the fact that the vast majority of women are women of color?
It's racism. It's just racism. It's discriminatory bias. It's the stuff of what the fabric of this country is, why they're blocking critical race theory and everything else. You know, when you read like true books that are true about the origins of this country, you would see that everything from gynecology, everything.
I was about to say J. Marion Sims, gynecology.
It is off the back of slaves and slave women. And so with that being said, it's just not like it just cut off in 1950, right? It's just that
Which
thought
was just
process.
Yesterday.
Correct. The thought process that, you know, Black women are not valued, that they are disposable, is a thought process in the mainstream of culture that has permeated into our current thought process. And, you know, I did, you know, just a video just saying, like, you know, my patient that came in and said that, you know, that they were sterilizing everybody after 2 C-sections in her video, whatever. I'm like, oh no, that doesn't happen. It does happen. She's not lying. She's not lying. And you know, you look back 50 years ago, literally, you know, hysterectomy was called the Black woman's appendectomy, meaning that, you know,
isn't it like 3 to 4 times the rate of white women, Black women have hysterectomies?
Absolutely.
I recently met Karen Dorico of the Doricos on TLC. Are you familiar with that family? They have the multiples. They live out in their Black family. They were just on Good Morning America. Okay. And their show is called The Doricos. It's on Tuesday nights on TLC, and you can also stream it on Discovery Plus. Amazing Black family. They have 2 single births, their first 2 births. And then they have Darian, their 17-year-old. Their oldest is actually at NYU right now for a summer program with Adam Sandler and Ben Stiller's kids, which is pretty awesome. And they have Derek, which was their second single birth. Then they had twins, all right? Then she has multiples on both sides. Then she got quintuplets, all right? And then she had all natural, no IVF. Then she had 2 sets of triplets, okay? Now, one of their multiples, the doctor says to them, oh, you're having multiples. You know, you want to go ahead and have an abortion. Go ahead and get rid of it. And they were like, what? They were like, yeah, you already have, you already have 11 kids. It was the triplets. You already have 11 kids. So they were like, no, but they didn't just say like, they were like, well, you already have 11 kids. Like, you know, that judgmental, like, you still copulating, you still,
like,
you know.
Like,
yeah. I have 14 children, all healthy, all whole, all having, you know, an amazing life with 2 Black parents who are raising an amazing family, you know. But the idea of what you said, that racism, like that judgment, right? That oh, you're not supposed to be having all these kids.
We get the misconception that, like, when people put on different suits or garbs, that the racism just sheds off. Like, if you put on a police outfit,
please, you become more of it.
Right, you put on a white coat, that you really are not a bigot or racist anymore, and that's just crazy. Like, racism it's alive and well, and it doesn't stop just because someone hits a level of success or education. It just doesn't.
Yeah, I was telling Roland, I back in 2020. I saw what you posted yesterday from his town hall. It was so on point. It was fire.
I would love to meet him.
Oh no,
that dude.
I got it. I'm gonna talk to him about you. I'm gonna talk to him about you.
Amazing.
So I had a brain aneurysm in 2020, and it was during the pandemic, you know, and the pandemic, it was the stress of that. It was the stress of the racism outbreak, you know, with everything with George Floyd, and it was just a lot. And I had unchecked high blood pressure, and I have a genetic kidney condition that makes you more at risk. And I didn't know, you know, I never had high blood pressure before that. But during the pandemic, everything was on 1,000%, right? So I'm here in the hospital, found out, and it was nothing but God, brother. I woke up with the worst headache of my life. And it was August 12th, 2020, worst headache of my life. I said, God, I just cried out a prayer. God, what? And I heard the word aneurysm. I said, whoa. I called my doctor. He said, come get checked. And had I not gotten checked, you know what I'm saying? I went to go, got an MRA, because that's how you check to see if you have an aneurysm. Yeah. Found out, yes. Talking to the neurosurgeon says, oh, yes, you have a significant, they said, you're going to need a craniotomy. You have a significant aneurysm, okay? Yeah. And he says, I can fit you in my schedule in 8 days. You want to go home and come back? Now, Doc P.
Absolutely not.
So, number one, I forgot to tell you, my blood pressure when I came in was at 166. I normally was 110 over 7 because my pain level was through the roof. Yeah. Now, I have, at this point, I've had like more than 10 surgeries. So, you know, my pain level, I have a high tolerance for pain. Yeah. My pain level is on 20 plus. Yeah. And I look at this doctor and I said, if my name was Becky and I just had my little tears, how quickly would you be fitting me into the schedule? Correct. Right? But because I'm an advocate for myself and I teach my clients to do this, I said, you know what? Sure, I'll go home as soon as you get my pain under control so that my blood pressure can get regulated. Right? So that's how I hit him. Right. And he says, oh yeah, that'll be no problem because the pressure is crazy because the pain is crazy. Right. Next day, they're spending the whole day trying to get me, because I can't take NSAIDs because of polycystic kidney disease, which is the genetic kidney disease I have from, you know, genetic, a dominant kidney disease. So the bottom line is everything they throw at me, nothing is making this pain go down. They have had to now give me IV injections of high blood pressure meds to get them down because the numbers would just keep going up. I said, what would have happened had I gone home? And how many people went home because the doctor said, I'll fit you in next week? Crazy. And then you think it doesn't get worse? The next day, they're telling me after they've had to do like 3 or 4 emergency, you know, pumping the IV through the, you know, the high blood pressure medicine through the IV, because taking the pill doesn't work that fast, right? If your number's climbing like that, they send someone says to me, oh, so when are you checking out? Because, you know, insurance needs you to come back by a certain time in order for it to be covered. I said, how about not at all? I'm staying right here. I said, I'm sure if I stay right here, they'll cover it too. Right. And they said, oh, well, maybe. I said, go ahead and call them. I said, and call your boss for me because I need to talk to him. Right. And, but here I am. I'm trying to keep my pressure down. You know what I'm saying? But I'm having a fight for my life. Yeah. It's crazy. You see what I'm saying? Right. So the racism piece you said is on point, on point. Last 2 questions. First thing I said was, at the opening, I said, should I be groomed a certain way to go to the GYN? You said groomed? Yeah, people think, you know, like, you know, be clean, be hygienic. People feel like certain ways, like you ain't going on a date. You know what I'm saying? You know what I'm saying? Right. What do you say, Dr. P? Honestly, like, yeah, I can care less. Like, I don't see it. You know, I don't. Just normal hygiene as far as being clean. Like, to be honest with you, my biggest thing is feet. Like, and that's crazy. People like it's not vagina. It's not. You don't really smell the vagina part, but if your feet are must. When you come to the doctor, you like, please clean your feet. Clean your feet. Just clean your feet and wear clean socks. You know, if you don't want to shave, you don't have to shave just because, you know, it's personal preference. That's a personal preference. I say this because some people may feel like a certain way. But everybody just don't like that. That's fine. But as long as you clean, it's fine. Like, just be clean. I personally. All over. No stinky feet. I personally don't care about if you have, you know, just a hairy monster all over the place. You got hair everywhere. It doesn't bother me at all. That's none of your business, right? Ain't none of my business. I'm just going to see what you got, what I need to do, get in, get out. I'm out of there. I'm not even looking to see, you know, your legs got, you know, could be braided. You know what I mean? I'm not looking at that. No, that's not my business. But can I ask you something? But you know, women have these complexes, like, because it's a lot. It's a lot. You know, my husband always be like, oh, I have to go, you know, once every whatever. I was like, dude, come on, please. You talk about the level of invasion that we deal with. It is very invasive. It is very invasive. It is very invasive. But I mean, just so you know, nobody's talking about you if you're clean. That's it. I can speak on behalf of a majority of gynecologists. We can care less what type of hair you got, tattoos, any of that thing. As long as it's clean, we're good. Clean, 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 and clean feet.
That's it.
And should I cancel my GYN exam if I'm on my period?
For me, absolutely not. I had
Let's talk about why.
like an old partner of mine, like she would just cancel people's appointments if they're on their period. I think that's the worst and most insensitive, ridiculous thing I've ever. You're here for that.
Yep.
Typically, you know, that's like canceling a surgery because you're on your period. And I have patients that call and like are freaking out and like, you know, call on the day of surgery and say, I can't come in. I'm like, you're here for that. If I had to plan my life and my schedule around women's periods, it would just be total chaos, you know? So for me personally, I would never, ever, ever tell anyone that you can't, that I wouldn't see you or do anything because of your period. It just doesn't make any sense whatsoever. But there are gynecologists like that, unfortunately. So do your research. Yeah, that was you.
Oh.
that was you for sure. But there are gyne OBs like that. And for me, I would say, hey, you know, find you another OB. Like you need to have that somebody because you had a natural process of life going. They shouldn't be doing the job, honestly.
While we're at talking about periods, this is really important because guess what? If something also, if you are bleeding so heavily that it is making you, don't you think your GYN needs to see this, needs to know this? That's a very important thing.
Absolutely.
You know what I'm saying? Like the idea. And the other thing is, if your GYN tells you heavy bleeding is normal, find another one. That person doesn't know what the hell they're talking about. Okay.
Absolutely.
Okay.
And then do this, I will put this in there for everybody. Like, two things can be true at the same time. You can have heavy bleeding and you can have fibroids. They can be exclusive of each other. I have women that have horrible fibroid disease and have horrible bleeding. I have women that have the same age, same demographic, same body type with horrible bleeding and no fibroids. So
but they probably have hormone disruption though, right? The hormone disruption causes that too.
So just understand, don't let anybody just say, oh, it's got to be your fibroids. Like, make someone explain to you what they're talking about and what's going on with your body. And if they are wishy-washy and it's not put in a very clear, concise way for you to understand, and you just got to find a different person.
Yeah. You know? Two things somebody just said. Number one, they said, and then they put you on birth control. 65% of people who are on birth control are for non-contraceptive reasons. And the birth control literally stops your hormone process. There are too many other ways to deal with this, women. Seriously. In fact, so many women have developed things because of the synthetic hormone that your body's being pumped with, have developed other complications such as fibroids or endometriosis or infertility. So if that's the only thing your GYN is recommending, that's another flag. Someone just asked Dr. P, they said that a lot of times people will say, oh, but if you're on your cycle, the lab test won't be accurate. So your pap smear is not going to be accurate because you're bleeding.
That's slightly true. That is true as far as the pap smear is concerned, but you can still clean the cervix. You can still clean down there. Like it's just because you're on your period doesn't mean we can't get a good sample that's not bloody. So yes, that is true. If you have a fully bloody sample, it can
but it's a little bit more work. They can clean the cervix and get a clean sample for you.
Absolutely.
Right.
Absolutely.
That's important to know. All right. And then the other thing somebody said earlier, which is really important about the UFE, they said, well, I had mine and I feel so much better. I don't have heavy periods and stuff like that. And I wanted to address that because a lot of times people will think it's just like when you have the fibroids removed. Okay, but what germinated the fibroid was never addressed. And that for me is always realize that whether, yes, there are fibroids that have to be removed because they're causing you life-threatening or quality of life derailments, right? But always remember, I still need to think about what the root cause that's present, whether it was the estrogen dominance or the deficiency of vitamin D, whatever. Again, there's so many studies. That's why I want to send you the book as well, Dr. P, because we have so many studies linked to it. But in terms of the root issues that are present, it could be toxic relationships that are causing you to have hormone imbalance in your life, or this crazy trash diet Dr. P was talking about, right? if we don't address those, it's just going to manifest in another way.
Mm-hmm.
All right. So you said that the UFE helped, but what caused the fibroids was that, like, sometimes when I have a consultation with a client, I say, okay, let's look at when you developed the fibroids. Let's look at a period in your life they were growing aggressively. What was going on in your life? Let's look at what was going on. Were you going through a divorce? Did you have a death in the family, right? Were you going through a toxic relationship? Were you eating crazy? Was the jobs crazy? And then the other things is, you know, when it looks at the environmental toxins, these are things that you can make changes to certain things, and you can supplement to support your body through the other things in addition to that. So, you know, I wanted to make sure to address that, because a lot of times people will think, it's like you said, you, for one thing, you're addressing one thing, but then what else is going on in the body that's not being addressed, and how else is it going to show up? I think you already said this, and you know, I was going to end with, what are 3 things you want every woman battling fibroids to know that you don't believe their GYNs are telling them? Is there anything that you haven't shared?
I mean, the 3 things that I would take away, or that I would tell any woman, is number 1, you always have options. Don't let tell you that you have to have a hysterectomy, or you have to have something done. Like, you have options, and OBGYN should be able to really detail those options and what makes sense for you, right? Number 2, just know that, you know, things that people just say sometimes are just not true. Like, for instance, like vertical incisions and things like that. Like, get 2nd, 3rd, 4th, 5th opinions. Like,
Yep.
I have patients that come to me now that are literally, I'm like their 7th, 8th doctor, and I'm the first person that tells them that they can actually have what they're looking for. So always don't let your region dictate that you're going to get. Like, women are flying all over, men are flying all over for, you know, cosmetic procedures, paying all types of money, doing things. When it's something that you really want, you'll make it happen. So don't let something that you really need be dictated because, you know, because you're living where you're at. Do your research. I have women that fly in all over the country to have surgery. They make it happen. Some of them wait 6 months to flip it over to open enrollment so that they can actually get it paid for, or whatever. Do what you have to do. Like, you can make it happen. Just do what you have to do. And the last thing I would say is that there are many misconceptions that permeate amongst our community. And a lot of those misconceptions come from a real place. I will never, ever look down upon anyone for having a fear of surgery, having a fear of coming to see me, or having a fear of anything. I never look at that, because behind that fear, there are true stories of your aunts, your grandmothers, your cousins that have went through horrible things, that those fears are really coming from a genuine place. But understand, when you find somebody that's going to break things down for you, you know, like I tell my patients all the time, I'm not talking to you no different than I'm talking to my sister, my mama, my auntie. When you have that person, believe what they tell you. Like, just believe what they tell you. And as much as hysterectomies have been used to weaponize against women, some people, you need hysterectomies.
Some people do need them.
Some people, you need them, but you can have them where it's minimally invasive, where it's going to really address your problems. And that's the biggest thing. That's the number.
What's the case, you know, because I do want people to think about that. What's a case where, because even if you are having a hysterectomy, you know, you can still harvest egg. You can still freeze your eggs to be able to have children. You know, there are options now, right? It's just like when there are cancer patients, you know, if they're going to go through chemo, they recommend that they freeze their eggs so that they have the option for fertility afterwards. What's a case where you said you need the hysterectomy? Like, when you say when you have to have, because those are not, you know, every case. In fact, I hope that they're rare, but unfortunately, they're common.
Patients right now, like, literally. So, and sometimes this is a hard concept to grasp, but The purpose of your uterus is to bear children. That is the only physiologic reason why you have a uterus. No one should take it away from you without your consent or tell you that you have to have it. However, I asked two questions. What is your goal? If your goal is to have a child at the end of the day, then every option for you to preserve your uterus should be given to you. But if your goal is to not have children, you've had all your children, and you're suffering with bleeding, you're suffering with horrible fibroid disease, and you're suffering with these things, it has to be on the table to remove the thing that's making you suffer. So for me, I have patients that are coming in 48, 49, 50, 51 that are totally done with having children, that have absolutely no interest in having children, and have advanced fibroid disease. We're talking, 26, 28 week gestational size fibroids, but their mind losing their uterus is going to make them not a woman. It's going to be, a lot of different myths and things that come behind it, where in truth is that by preserving your uterus at this juncture is actually more harmful for you than to remove it. Because as I told you before, like I do every hysterectomy robotically or laparoscopically, but the myomectomies are open. So if you need your uterus, absolutely, that's the risk that you take, because at the end of it, you're doing that to preserve your fertility. But now with that incision, you got increased risk of infection, increased risk of bleeding, increased risk of complications. So do it when it makes sense. And that's what I see. When it doesn't make sense and the thing of making sense means that you're doing it for a reason, not just to say, hey, I want to keep it. Because the same thought process doesn't go to your appendix. If you had an inflamed appendix and it was giving you all types of problems,
they would just
taking
remove
you having an inflamed gallbladder, and
they took mine on past surgeries.
Your uterus is similar into the fact that if it's giving you problems and you're not trying to use it anymore, you should have options that are going to address the problem.
When you say that though, what about the implications, the hormone implications, and how many women post hysterectomy end up being put on hormone replacement drugs, like they almost did with me, even though they left my ovaries.
So but you also had a UFE, so there's no. So what are
so you don't see many cases where there's a hysterectomy and the ovaries are kept and they're thrown into
there shouldn't theologically be any reason for that.
There shouldn't be, right? But there
should not be, because if you have and if the surgery was done appropriately, and actually what was done in the surgery was what was actually done, then you should physiologically continue to produce hormones. Now, what can happen too is that if you're 48 and you're getting a hysterectomy, you may be at the end of your rope. You may be you already have.
Yeah, well, no, I wasn't at the end of my rope. Definitely not. I was only like 40, but
just saying, just in general.
No, I know what you mean. Like it was basically like it was an event of, what do you call the perfect storm, right? Where your body is going into one season and your uterus was removed at the same time.
Yeah.
Yeah. I mean, and in all of this though, in the end, when we look at all of this, for us, we're on the end where we're trying to help you not get there where you don't need the surgery ever, because with every surgery is the risk that come with it, right? We're trying to get you to the point where you don't, and he becomes the baby deliverer more than anything else. Do you deliver babies? Barely.
Barely. When I'm on call, like I'm on call right now, but I don't have any prenatal. I have one prenatal patient.
There you go. Well, listen, there are seasons in life. That's my goal is for women to really be equipped and educated so that they're able to take control of their health earlier on, so that they're not dealing with fibroids that are in those stages. That's the goal. But if they are, I want them to know that they have options, to prevent before and then to fight them integratively, meaning we recommend they fight them if they need to do the surgery, but then also fight them through the lifestyle changes at the same time, so that on post-op end, they help to prevent further development of fibroids, right? So it's the and know that I think a key thing Dr. P said is you always have options. You always have options. Make sure that you are speaking to people who are going to tell you that you always have options, and they're going to listen to you, right? I'm grateful for our time together. I look forward to having more conversations, and of course, know that I got your back. People say that, you're somebody you're not. I'm like, I know who Dr. P is. I didn't talk to him myself, because there are haters out there, Dr. P.
I know.
But we don't care about haters. We care about helping people heal and live healthy lives.
Yeah.
That's the bottom line, right?
As long as the people that I help, they on my side, and they're very appreciative. The haters can hate all they want to. I got an army of women that'll fight for me, so I'm okay.
Hey, that's it. That's all right. And I'm sure their families are right supporting you too, because they're helping them get their lives back. Well, I appreciate your time, and thank you so much. I hope this was worth your time.
It was.
And I look forward to, cross collaborating more and more, as we help these people, as we help our people heal.
Absolutely.
All right. So everybody, thank you so much. Did you have anything else you wanted to say, or anything you wanted to share? Follow Dr. P if you don't follow him already. Yeah. He is definitely, he's tagged here.
And, all those things, like all that stuff's on my page. So follow me. I have a platform too where I just, I talk about a lot of educate.
Oh, the show. We didn't talk about the show. What's going on with the show?
So the thing, just real quick, like I have like the first episode done, all that stuff, but there's an agent that said, like, listen, people are going to be really interested. There's networks that are really interested. Don't release it.
Oh, brother, are you kidding?
Yeah, so I'm holding. So right now it's just like in network negotiations right now. So I'm just holding.
That's good. We'll be putting some prayer on that.
Yeah, appreciate it.
All right, folks, thank you so much. And listen, one of the things our job is to help point you, connect you to the right people, support you on and through your journey, right? Help you to live what we call detox living. It's life free of toxic thoughts, people, habits, and foods, right? It's that food is in there. The people are definitely in there, right? As well as the habits, and making sure that you're living that toxic free life so that you can optimize this thing called life that we have. We're here for you. We offer free group consultations as well as free consultations period to empower you with education and information. Know that for us, we are here to partner with you in this thing called healthy living. That's the real health. That's the real wealth. Health is the real wealth. I know people say it, they say it real trite, but it's for real. It's for real. All right. So thank you so much. We're going to post this replay for y'all to access. Share it, because people who need it. Tag them. They need it.
I don't.
All right.
Oh yeah, look for people it's people out here. Like, I'm not the only one. There are other doctors out here that really care about us, and they all don't look like us. I never want anybody to think it's like I'm just saying, hey, just anybody that's not black, don't mess with them. Like, I know some very genuine.
However, there are ethnic concordance does make a difference. I have to say, it
makes a huge difference. But just find the people that are out there that are really, really going to advocate for you, listen to you, more importantly. So they're out there. Just look and don't let you.
And something you just brought up is advocacy. Like, because I have clients now who will text me from the doctor's office, and I'll say, look, ask these questions. Yeah. You have to have a tribe of people. That's why you have doulas, you have coaches, you have support people, because a lot of people go into these situations and they don't have support with them. And what happens is there's something that happens sometimes in doctor's offices and appointments where people they shrink back and they get scared and they kind of just, don't ask the questions. And that's why I don't go alone. I'll have my brother on the phone. He's a PA, or I'll have my partner, Dr. Amun. I'll have him help me ask questions or whatever, because you want to know that you don't realize sometimes you have blind spots. There's something that happens, that psychology thing you talked about. It's something that happens. And yeah, you're not alone. All right. Thank you, folks.
All right, everybody.
Hey, I just realized I didn't answer a question. Yep, I see you. I'm so sorry. Somebody said, what are the options other than surgery? So for us, I highly recommend you either take advantage of our free quiz or our free consultations that happen weekly. Go to the detoxnow.com. We have weekly free consultations, as well as we have a free quiz you can take. And we want to make sure we have a fibroids kit. We have the book I talked to you about, the End Fibroids Manual and Guide, that gives you, oh my God, talks to you about all your options, talks to you about the root causes. We have amazing testimonies of helping people to help support their bodies in eliminating fibroids naturally if their bodies are in their place and they're disciplined and they want to, as well as helping them to prevent the return if they've had a myomectomy and they want to, or have any kind of abdominal surgery and they want to prevent or hinder the complications that come from having any kind of abdominal surgery. So that's really, really important. So you want to prevent before, you want to fight if you're dealing with them, and then you want to prevent post-op and manage after that. And our fibroids kit, we have support for you at whatever stage you are in. I'm so honored and humbled to be able to support you in that. So please check it out. Take our free quiz, and you can save 25% off by taking that quiz at thedetoxnow.com. And we're here. You can be fibroid free for good. Too many women have had myomectomy or a procedure and they didn't tackle the root cause, and then they ended up with another. And I am one of those women, and because I've gone through so much, I am committed to making sure that you don't, my sister.